Good morning, everyone, and I hope everybody had a good Easter and good Passover. We're joined by our sign language interpreters. Deeply appreciate that they're here today. And I wanted to once again thank all my cabinet heads and rank and file for what they continue to do day in and day out, 24/7. And again, I'm deeply appreciative of Dr. Mark Kerouac, who is the President and CEO of Bay State Health Systems, and Dr. Robert Roos, who's the Chief Medical Officer for Mercy Hospital Trinity, taking the time to be here. We also have Bob Kushner, industrial hygienist, who is our specialist for our homeless facility from O'Reilly Talbot Oaken. He'll be speaking on the specifics, technology of the tenting that we're doing, and I believe AMR officials are here, whether Patrick Leonardo or Patrick Leonardo is here. They're partnering with us at the homeless facility too, so we deeply appreciate that on the overnight. With that, I'd like to first open up with a moment of silence for all the families who have lost loved ones to this hideous COVID-19 coronavirus situation, and especially to my dear friend, that slugging second baseman, Tony King from the Holyoke Soldiers Home at 102. COVID-19 coronavirus took him away from us. Again, he was part of that 1934 American Legion team to go play for the National World Series, Post 21, Gastonia, North Carolina, when they took a stand against racism, and that well before Jackie Robinson and well before Dr. Martin Luther King. So if we could have a moment of silence, I'd appreciate that. Thank you very much. Our totals have risen to 541 who have tested, Springfield residents who have tested positive for the COVID-19 coronavirus. To our knowledge, 11 have passed away, and may God rest their souls, and my sympathies go out to their families. I'd also like to put across that my Commissioner of Health and Human Services, Helen Carlton Harris, who, like all of my cabinet heads, has done yeoman work, will be explaining the mapping as we're tracking and the areas and some statistics. And she'll be announcing a hotline that we're going to be operating from now on. I'd also want to give a big thank you to our private and business sector. When I made my clarion call that PPE, specifically N95 and KN95 masks, were needed for my brave and dedicated police officers and firefighters, boy, have they come through big time. So another big shout out to CRRC, the largest railway manufacturing company in the world, that is here in the city of Springfield. 10,000 KN95 masks. To Holyoke Medical Center, Spiro Hatteras, good friend, came through right away. Mass Mutual, Sheriff Nick Kochi, who's always been a great partner. Tyflex, which went directly to the fire department. Merrill Lynch, also to a really heartwarming story, a school in Newton, and a Chinese family, a student daughter that went there, heard about this, and the family wanted to help out, and Springfield native Tim Murphy, masks that were dropped off here. MGM has been a very good corporate citizen, helping us out with our homeless triage facility with heaters and also cots. And then through Commissioner Claproot and the Commissioner Gross from Boston, and the Chief of Chelsea Police, who came through with N95 masks. We deeply appreciate that immensely. I'm going to make another plea to the public. We're in desperate need for thermo-infrared thermometers. We made a request, and I'm very appreciative of MEMA with the supplies they've sent us for our homeless facility, triage facility. But the thermometers that came in were oral thermometers. That makes it quite difficult to get temperatures of our, from cabinet heads really down to rank and file, police and fire rank and file every day. So we've tried to go to the private market, the open market. There's none to be found. We have orders in. So I could use, please, again, I could use a dozen infrared, thermal infrared thermometers ASAP, especially for our police and fire. I'd also like to indicate, and Superintendent Warwick and our early morning cabinet head updates will speak more about Governor Baker and Secretary Riley canceling the MCAS this year, and he'll speak more about what might or might not happen with the school sessions. We're well over 200,000 meals, breakfast, lunch, dinner, now snacks will start today being served to our students and families, 17 or 18 locations, school locations throughout the city. We already had 7,000 laptops out to our students with our home learning prior to this COVID-19 coronavirus crisis that we're facing now. By this week, we'll have 10,000 more laptops, virtual learning, out to our students and families. So that's 17,000 total. That's quite a testament, Superintendent Warwick and administration and staff. Police, Commissioner Clapper will give you an update. They're down 21 and 1 civilian. The National Guard has been working out fantastic, fantastic. And we deeply appreciate the state allowing me to get National Guard here. General Keefe, thank you so much. They've been just absolutely wonderful. And to Colonel Mason, State Police have worked out wonderful too. We have 9 to 12 State Police that are working on our shifts too, besides our brave and dedicated men and women in blue. Commissioner Calvi, Fire Commissioner Calvi, BJ will give you an update. He's down 6, and then he's going to make an announcement pertaining to food bank aspects. Director Chris Signoli will speak briefly. He is down, I think, Chris, you down 2? Still down 2. And yard waste, which was all, I saw them out Saturday. They're all caught up on yard waste. And I thank everyone for their, Commissioner Clapprood and Director Signoli, all their assistance with the Central High School food bank we have going on there. Pat Sullivan will speak to you. Done great work on this state-of-the-art homeless tenting triage we've put up across from the Friends of the Homeless on Worthington Street. And Bob Kirshner will speak even more to the technicalities that we put across. Tim Sheehan, my director, my chief development officer, another $500,000 is going out, small business fund. Those applications will be due Thursday at 5 p.m. And again, we're going to try to continue to help out every small business and restaurant that we can. We do have to follow HUD and CDBG recommendations, but that'll make for $750,000 out. And we've already signed contracts Friday night, so hopefully they'll be receiving their checks this week on the first round. And then my financial flow with my CAFO, TJ Plain, who continues to track everything. We've spent so far $944,000, nearly $1 million. In lost revenue, it's 2.3 in lost revenue and other revenue that we're looking to recoup from other sources as we continue to work with everyone. And I think at this point in time, I want to make sure I gave you all my updates. Last thing I'll say before I bring up Dr. Kerouac and Dr. Roos is that eventually there's going to be a phase-in of getting back to some type of normality. And it'd be a good segue bringing up the medical experts. We must make sure, I want to open up just as quick as anybody else, but we must make sure that we follow the health, medical, and science advice before we start to reopen, whether in a phased fashion or fully in a full fashion. We've seen other countries that have opened up maybe a little too quick, and the COVID-19 coronavirus reemerging. So without a vaccine, and I know they're working hard to create a vaccine, we have to remain cognizant and really continue to follow, though they seem common sense and simple, the washing of your hands. Wearing those masks, especially if you're going to areas that there might be a little bit crowded, even with social distancing, if you're going out there shopping. And again, if you're not feeling well, to make sure that you stay home. In the meantime, we're going to continue to stockpile our supplies and materials, just in case. But believe you me, we will prevail. We will starve and kill this virus. We will get through this together as one and for the better. I deeply appreciate the patience and understanding that has been shown by our Springfield residents and by our business community. And I deeply appreciate, even with the storm clouds that now face us, there's a lot of sun that shines with the generosity and donations, the ones I mentioned with the N95 or KN95 mask, or just simply the food deliveries that are being made left and right to our first responders. So especially on the front line in our medical facilities, from janitorial all the way up to doctors and nurses, tremendous job. To our DPW workers, to our grocery workers, to our mail handlers, post office, all those little things, our truck drivers, warehouse, everybody is pitching in together, and I'm very, very proud of that. And at times it can get a little bit emotional, and at times I might be a little forceful, but I'm only doing it for the good of the Springfield residents and our business community. With that, I want to turn it over to the President and CEO of Bay State Health Systems, Dr. Mark Kerouac. Thank you so much.
Good morning, everybody, and thank you for the opportunity, Mr. Mayor. While we're still in the throes of this pandemic, the overall feel of the situation is quite different at Bay State today. A little over 2 weeks ago, there were 106 confirmed cases in our Bay State Health hospitals. Today, there are 169. This means that the doubling time for inpatient cases is longer than 2 weeks, perhaps much longer. The flattening of the curve that we've been speaking so much about is happening. Also important to note is that the number of patients on ventilators in the ICU at Bay State Medical Center continues to decline. On a call with the other CEOs of Western Mass hospitals last Friday, they all reported the same thing. So what do these trends mean? It means, for one thing, that all of the hospitals are now getting better at managing these patients. At Bay State Health Hospitals, we now have managed over 400 COVID-19 positive patients, over 400 in our hospitals. Our intensive care specialists have gotten more skilled at keeping patients off of ventilators by using high-flow oxygen and positioning them on their stomachs to ease their breathing. Fewer than half as many of our admitted patients are ending up on ventilators compared with the Boston hospitals, something we're proud of. A majority of the deaths we've seen have been in elderly patients toward the end of their lives, in which either their or their family's wishes were not to pursue aggressive measures such as intubation and ventilation. Having this clarity on patient preferences early in the course of illness has helped guide the care we provide. As we look across the hospitals of Western Massachusetts, we're holding steady at a level that is less than 50% of our planned surge capacity. And that's why Bay State declined the offer from the state last week to stand up a field hospital at the Mass Mutual Center. We feel we have enough beds to manage a significant surge at the current moment. We appreciate the addition of testing for all the first responders at the site at the Big E in West Springfield. We continue to expand our own testing, and we now are offering drive-through testing for Bay State patients in several sites in our service area on an appointment basis based on a referral from your doctor. We'd like to offer drive-through testing for anyone interested, but we still don't have the testing capacity to do this level of expansion. We continue to fight every day to ensure adequate supplies of personal protective equipment, as the safety of providing care as the safety of all providing care for our patients is our top priority. We're pleased that our efforts to purchase equipment have yielded good results in the last week, and we're deeply grateful for the donations that we have received from the community. We now need to turn our attention outward, beyond the walls of the hospitals, to the areas where there's a risk that infection will still spread rapidly. These include nursing homes, jails, and shelters. We've provided support to the state at the Holyoke Soldiers Home as they gain control of that tragic situation, and we're reaching out to nursing homes to ensure that appropriate testing and infection control practices are in place. We're also working with local civic leaders throughout the Pioneer Valley to help contain community-based hotspots. We also have been reaching out to the patients from Springfield who get their care at our 4 health centers at Brightwood, Mason Square, High Street, and the Western Women's Clinic. We have the advantage of having started 2 years ago a Medicaid Accountable Care organization in collaboration with Health New England and Caring Health, which is responsible for the health of 38,000 of the most vulnerable citizens of our city. These are predominantly people of color, whom we know have a greater than expected burden of diabetes, high blood pressure, smoking, asthma, and obesity, all factors which contribute to a higher than expected death rate from COVID-19 infection in these groups. We're not yet seeing these trends in our areas, but we will continue to monitor the data closely. There's still time to blunt the effects of the epidemic in those at greatest risk for serious disease. Our teams will be working with Commissioner Carlton Harris and the many social service agencies we collaborate with in the Medicaid ACO. In addition, our faculty physicians at UMass Medical School at Bay State are implementing or exploring 9 different trials of investigational treatments, and we hope to add to the national knowledge base of what works to accelerate improvement. We hope that our message of social distancing will go out to all those who can help us make this happen across the city. It's important to recognize that the trends tell us that social distancing is working. The advice that we have been consistently given to stay at home as much as possible, to stay 6 feet away from other people as much as possible, to cover your nose and mouth with a tissue or sleeve when you cough or sneeze, and wear a face covering when out in public is working. Following these practices provides our best chance to prevent needless deaths and suffering. To quote Winston Churchill, "This is not the beginning of the end, but it is the end of the beginning." Our care providers now have greater confidence that they can handle COVID-19 cases, and the patient successes far outnumber the failures. The great majority of patients admitted to Bay State Health Hospital since the beginning of the epidemic have been successfully discharged. And in the last few days, those who are discharged are accompanied by a practice that's gone viral across America called Code Rocky. Whenever a COVID-19 patient is discharged, the music from the movie Rocky is played briefly overhead. A broadcast page goes out, and all who can spare a moment come down to the lobby to give the patient a huge ovation as they leave the hospital. You can check out Code Rocky Bay State on Facebook if you want to see the video. This has been a great lift for our patients and staff alike, and it serves as a reminder of our success in this fight and brings hope to our efforts to gain control of this formidable foe. I continue to be in awe of the amazing team we have at Bay State. Our team members are your family members, your friends, and your neighbors, making a commitment unlike any other to ensure the best care for our community, and I thank them from the bottom of my heart. I appreciate the leadership that you've shown, Mr. Mayor, as well as your commissioners and the whole leadership team here at City Hall in being strong and steadfast in your messaging. Let's keep following that advice on how to stay well, as difficult as it is, so that we can see the current flattening turn into a downslope and manage our way to a new world after this pandemic subsides. Thank you.
Thank you, Dr. Kerouac. Thank you, Dr. Kerouac. And again, at the end of our update, Dr. Kerouac and Dr. Roos will be the first ones to handle any and all questions so they can get back to their important duties at Bay State and Mercy. Before I bring up Dr. Robert Roos, just another update. I want to thank my election commissioner, Gladys Ayola, who represented me on a Latina media outlet podcast that was done to make sure that all those individuals and families had the information as we continue to conquer this COVID-19 coronavirus situation that we're in. Also on Springfield, my website, Springfield's websites, we translate to, Billy, I think it's nearly 90 languages. It translates all the information which we update daily on there can be translated. It is right on top of the screen there. You can translate to nearly 90 languages. So we want to make sure that each and every one of our families, individual groups, ethnic groups we have here are getting that information and assistance loud and clear. Without further ado, I'm very, very appreciative that Dr. Robert Roos, who is the Chief Medical Officer for Mercy Hospital Trinity, is here once again, and he will give their update. Dr. Robert Roos.
Well, good morning, and thank you, Mayor, and to all the commissioners for your continued strong leadership and partnership in our fight against COVID-19. And I want to give a nod to Dr. Kerouac and the leadership of Bay State Health as well, who have been tremendous partners for all of us in this community, along with the other hospitals here in Western Massachusetts, because truly this is something that we are working on together. I hope that everyone had a peaceful Easter, and I find it particularly meaningful that we're talking today after Holy Week, where many individuals celebrated Passover and others Easter and others preparing for Ramadan, where amidst much darkness comes tremendous light. And today we are having some significant storms from which we know will spring forth life and beauty. Last week I mentioned that as an addiction medicine physician, I've had the experience of also working on the front lines of a tremendous community epidemic, the opiate epidemic, which has been something over the last decade that has also impacted all of us, our entire community, from business to health to others, and remains the single greatest cause of accidental death in the United States. And similarly, through that crisis, but also through this crisis, I've come to know, as many of you have, the stories of hope, the strength that comes from community, the resilience that's demonstrated in many, many people and organizations, and the truth that is recovery. And that's what I want to focus on today. That even though these are uncertain times, that there is much light, resilience, and strength. First and foremost, for anyone who's had any questions all along around the effectiveness of the policies of social distancing, there is clear evidence that this works, including the banning of group activities, the physical distancing of staying more than 6 feet apart, the diligent hand hygiene, the wearing of masks in the isolation of those that are sick. This is definitely having an impact on the community spread of this virus, as the rate of new infections and the increase in hospitalizations or critically ill patients has not been at the rate that we once projected. And that's tremendously positive news. In fact, our predictions, which mirror the predictions of others now, are predicting more of a sustained plateau of infections rather than a steep peak that could overwhelm hospital resources in a dramatic way. And that's a promising sign. But it is in no way to be mistaken for this being a time to relax those principles that have helped tamper this disease. In fact, we must not get complacent. This is the time to ensure that we exercise physical distancing, hand hygiene, staying away from group congregations, and isolating when we're sick. But it is, in fact, a sign that each and everything that you do can make an impact on this. Secondly, it's important to recognize that the vast majority of individuals infected with the novel coronavirus do, in fact, have a milder disease and can recover. In fact, even amongst patients that come to the Mercy Emergency Department and have tested positive, less than half have needed an inpatient hospitalization. And additionally, of those that have been hospitalized for COVID at Mercy Medical Center, more than half have already stabilized, improved, and been discharged. And so in total, that vast majority of people that have tested positive are in fact doing better. This is not to minimize the concern, the tragedy, or the loss, but it's a story that has not always been mentioned, and it's been the direct result of the community pulling together. The evidence-based strategies that are in action, including those that we're working on now, and the excellent care that all the healthcare providers in this region are providing to our community. So it's been said, and it remains, that we will continue to work hard for you, but please stay home for us. In terms of our daily status update, at Mercy Medical Center and affiliates, we've tested 2,239 patients with 674 positive, 1,492 negative, and only have 71 tests still pending. You'll notice that those numbers of positive tests continue to increase as we receive test samples from various facilities all throughout the Pioneer Valley, including some skilled nursing facilities, as well as through the Mercy Emergency Department and Hospital. But you'll notice that the number of pending tests has dramatically decreased as we've been able to improve our test turnaround time. Within our facility at Mercy, we also continue to see relatively level rates and numbers of those hospitalized, such that it has been basically flat over the last 7 to 10 days. And that now patients under investigation or with COVID represent a little bit less than half of our capacity in the hospital, of our patients in the hospital, and well under 50% of our total maximum capacity. So we absolutely still remain open and able to treat people coming to the hospital for any and all conditions. Some additional examples of some progress made in the last week. Our last Tuesday, Mercy went live with in-house testing with our laboratory on an Abbott platform that has dramatically reduced our turnaround time, allowing us to more effectively make decisions regarding the treatment of patients and also conserve PPE. We continue to focus on the supply and the ongoing training regarding the use of PPE and also on what might have been a potential shortage of equipment like ventilators, and are grateful for the many donations, including some received now from the state through the federal distribution, as well as from Springfield Technical Community College. We also are appreciative of the partnership with American International College regarding the provision of housing to our healthcare workers who might be looking for an additional place to stay during this time to help keep their loved ones safe or even just ease their peace of mind. We're grateful for the collaboration as we look to innovative solutions for those who are most at risk in our community, in long-term care facilities as well as the homeless, both who may reside in settings that could be ripe for COVID-19 transmission. We are excited and grateful for that collaboration that has allowed the homeless population to have a place to receive care and be isolated from the rest of their population going forward. And on the treatment front, some positive news. Through a regional effort with Trinity Health of New England, We are now one of a select few systems from around the country, including the Mayo Clinic and Johns Hopkins, who gained approval from the FDA to begin a trial that could involve the use of plasma donated by those who have been infected with the coronavirus and now recovered. Additionally, we've also dramatically increased the use of telehealth, or video visits, for patients who are needing care but are unable or shouldn't come to the office. And we're also developing a tele-ICU model within our hospital so that experienced clinicians can have a broader reach of who they can help provide care to. This is the type of transformation that will not only help us now, but will continue to help the community as we move forward in a post-COVID world in the future. So while at this point we still don't yet know the length or the severity of this pandemic, and there's a likelihood that this could persist for some time or perhaps even reemerge at a future date, there are indeed many signs of hope, resilience, and recovery amidst us. It is not time to relent on those efforts now. If we continue to learn from those examples, be inspired by them, and reinforce those efforts that led to them, I do know that we will overcome this together. Thank you.
Thank you, Dr. Lewis. Now, for you young parents, he didn't say Teletubbies. That's telemedicine, okay, on that. Also, I want to give a shout out to Governor Baker, Lieutenant Governor Polito. We speak all the time, and I appreciate all their efforts. And Congressman Neal, the chairman, Richie Neal, office of Friday, on his continued efforts on the federal level. Helen Carlton Harris, my elegant and eloquent Commissioner of Health and Human Services, has done yeoman work, my overall point person on this COVID-19 coronavirus, and she's going to speak on some specifics of the mapping and tracking that we're doing, statistics, and also on the hotline that we're going to have, and also on the homeless triage facility that we have built, state-of-the-art, which I believe we're up to 6 individuals who are needing of service. And then again, Pat Sullivan will speak of that too, and Bob Kirshner, who is the industrial hygienist specialist on what we've been able to put together there. So without further ado, the Commissioner of Health and Human Services, Helen Carlton Harris.
Thank you, Mayor, and once again, thank you for your leadership during these times where we were all trying to work together to address this pandemic. When I stood here on Monday for the City of Springfield, I reported that there were 254 COVID-positive individuals that we had received through the Board of Health. Let me say that the Board of Health, the Springfield Department of Health and Human Services, receives daily data from our MAVEN system, which is our infectious control system. It tells us how many individuals in the city of Springfield are COVID-19 positive. On April 6th, I told you that was 254. Today, it is 541. We have seen a doubling of the COVID-19 positive individuals in the city of Springfield. No zip code is left out of this equation. Every zip code in the city of Springfield is represented. I am going to show you a map of the city of Springfield where we have mapped the COVID-19 positives. The streets are not on this map. It is not our intent to stigmatize any neighborhood or any community around this virus. It is our intent to say to each resident that this virus is in our community and it is pervasive, meaning it is all over the place. I'm going to show you I'm showing you a map of the city. The red dots could represent one or more COVID-19 positive individuals based on household. And let me just speak to the factors that are represented in the map. First of all, density. When individuals live close together, it is more difficult to be able to social distance in their neighborhood. And so what you're seeing in some of the map are some zip codes, 01103, 01105, 01107, 01109, where you're seeing the pervasive dots, many dots, and that represents the fact that people are living closer together. It also represents that in those areas, there are a number of individuals who we know over the years have underlying health conditions and may be predisposed to COVID-19. And so it's important to recognize that density is an issue. If I look at Berkshire County as of Sunday had 350 COVID positives. Franklin County had 143. And if you think about those numbers total, it's 493. We are experiencing more COVID positives in Springfield than in both of those counties combined. And so density. When individuals are able to live further apart, when individuals do not have underlying health conditions, then we're seeing differences in the infections. I would also say to you that those dots also represent long-term care facilities, that we know there are clusters of infection. The State Department of Public Health, Department of Epidemiology, as well as the nursing supervisor at the Department of Health and Human Services, has been in touch with those cluster, long-term, and nursing facilities. We are extremely concerned, as Dr. Kerouac indicated, about that population. And so it's important that we do that outreach and try to help with mitigation in those facilities. Health disparities, we know, impact communities of color at a disproportionate rate, and that should be no surprise. Heart disease, cardiovascular disease, diabetes, asthma are some of the chronic diseases we know are disproportionately represented in communities of color. However, I want to make the point that this virus is in every zip code in the city of Springfield. So density is a factor, health disparities is a factor, chronic disease, underlying conditions, and also the workforce. Many essential workers who have to go to work are individuals who don't have a choice. They may work in grocery stores, they may be drivers, they may be deemed essential workers, however, they are taking a risk to go out and do their jobs. And so it is important that essential workers, workforce, individuals who are the persons who clean rooms, who are the workforce, who are making sure that we're all safe in many ways, are represented in our numbers. And so long-term care facilities and nursing homes are something, again, that we're keeping a close watch on those infection rates. You've heard it, I'll say it again, social distancing is very important. Both doctors gave us some amazing news that what they're seeing in their hospitals is good news as they're experiencing a flattening. What I'm seeing in the city of Springfield is a surge. And a surge means that we are seeing an uptick in those numbers. 60 on Friday, 45 on Saturday, 43 on Sunday. The good news to that is that those numbers are lowering. They're lowering not significantly, but it appears that we're seeing them come down a bit. But it is a surge, a doubling of COVID-19 positive in the city of Springfield in 1 week. I cannot say it enough. You've heard it over and over again, but let's say it one more time. Social distancing, physical separation, important, at least minimally 6 feet. Wash your hands, very important, wash your hands. If you're sick, stay home. Please do not come to work if you're sick. And then wear a face mask in places that you're going to be in public, particularly grocery stores, pharmacies, those places where you go, where there are individuals in the environment. And oftentimes, as hard as we try, in those settings, social distancing is not always possible. I want to end by saying the work I do, which is public health, is a social justice movement rooted in science. The science is what will tell us in terms of how we come out of this pandemic. Pay attention to the science. But social justice tells us that there will be populations disproportionately represented when we come out of this. We'll be able to look back and know, and we're seeing some of that science tell us the populations that are disproportionately represented. And so I want to just end by saying thank you, as always, to Mayor Sarno for his leadership. We could not do it without the support of a leader who believes strongly in the work that we do. Thank you to the staff at the Springfield Department of Health and Human Services, Springfield school nurses. 6 of them are at my office now. This will make the second group of 6 that are at my office doing contact tracing. Bay State Medical Center, I have 2 nurses from Bay State Medical Center who are helping us with contact tracing. Mercy Medical Center, health care for the homeless, health services for the homeless. I can't say enough about the staff of health care for the homeless and health services for the homeless who treat a very difficult population every day, not just during pandemics, but every single day. And it's important that we acknowledge their work. So Mercy Medical Center, health care for the homeless, very important to say thank you. Our 330 Health Center, health services for the homeless, that staff, an amazing job. 75% of the individuals we treat at our health center are homeless. And it's a very vulnerable population, as you know. We are launching a COVID-19 hotline in the city of Springfield. Again, I thank the mayor for his direction and support. The number we will publish, but it is 413-750-3250. That number, again, will be published. There will be someone to answer calls related to COVID-19. If you do not receive and answer a human voice, please leave a message. We are checking that on an hourly basis, but it is staffed at this point. So in conclusion, stay home, stay safe, and as always, Springfield, stay strong. Thank you.
Thank you. Nicely done. Thank you very much, Commissioner Helen Carlton Harris. Helen, nicely done, and heed that advice. I know there is, I'm starting to see more and more, whether on radio or TV, even in print, but mainly TV, social media influencers who are now going out and about, especially letting our younger population know that they are not invincible. And you really need to heed the advice of social distancing. The weather is starting to warm, and some people think it doesn't or will not affect them. maybe it won't, but it could affect your family member, a loved one, or a close friend. So please, we need to be cognizant of that as we start to move forward and move away from this COVID-19 coronavirus, but we're still not there yet, and it has to be a very tempered approach. On the public safety front, I will bring up Police Commissioner Cheryl Clapprood. Herself and the brave and dedicated men and women in blue have been doing a tremendous job. They're still out there keeping us safe and sound and dealing with, they always have to deal with difficult and challenging situations, but even more so now with the COVID-19 coronavirus. So without further ado, Springfield Police Commissioner Cheryl Clapprood.
Thank you, Mr. Mayor.
Thank you, Commissioner.
Good morning. I greet you with no complaints or issues, which is strange, but I'm glad to tell you that. I think the reason I can stand here and have such a good report for you this morning is that we have no better advocate than the mayor of the city, who fought hard and fought last week so hard for his first responders. So the PPE came in in abundance. We are so grateful for everybody that helped us. I now make sure that all the officers have all the equipment they so desperately needed to do their jobs adequately and safely. As the mayor said, we have 21 officers still out in COVID-related illnesses and 1 civilian. So I'm 22 down as of today. But I do have 5 officers who did test positive for COVID who are back to work, and I believe within 48 hours, 2 more. So hopefully 7 officers back to work who did test positive, and thankfully their symptoms were mild. They recovered at home, which is good news for our law enforcement family. We are certainly grateful to all the donations of the PPE, and we're grateful for the food donations. They come to the police department. I send them to the substations. We've been enjoying lunch and dinners, and I don't want to name anyone because I'll forget somebody, so thank you so much. The Boys and Girls Club with their breakfasts in the morning, Breakfast for Heroes, thank you so much. So like the community, I'm able to report good numbers, and I believe that's because we're doing a good job and heeding the advice that was given to us from our Health and Human Services Director and from the hospitals. We're distancing, we're cleaning, we're wearing our PPE, we're doing our due diligence to stay safe, so I believe our numbers are what they are. Thank you to the National Guard. They've been doing a great job. No complaints, only compliments. People have been dropping off food for them as well. That is working out well. The state police, Colonel Mason, thank you so much. Your officers are also helping out every day and doing a good job, and it's been a really, really well-working team effort going on here. So again, everything is working well as far as the Springfield Police. Good arrests are being made. The women and men are working hard and diligently every day for you. It's our pleasure to take part in as many parades and ceremonies as we possibly can. I think it's good for our officers and good for healthcare workers. We went and visited yesterday afternoon. The response was great. I think it helps build morale. So we will continue to do that. Again, I thank you, the citizens of Springfield, and all my department heads and chairs. It's been a good working relationship. Mr. Mayor, thank you.
Thank you, Commissioner Clapprood. Thank you very much, Commissioner Clapprood, and it's good to get good news, feel good news, and that's going to temper as we continue to knock down this challenge. Firefighters, a couple calls this weekend. Parkside, you guys were out there and saving lives and saving structures, and you know, that bell tolls, or bell rings, and those brave and dedicated firefighters are there. So they're keeping us safe and sound. Without further ado, the Fire Commissioner of Springfield, Bernard B.J. Calvi.
Good morning. Thank you, Mayor. So the status update from the fire department is good this week. We have 6 members out currently. 1 has tested positive. 3 of those 6 should be coming back to work this week. So manpower-wise, we're in good shape at the fire department. Over the weekend, we did have a significant fire in the Liberty Heights section. It was knocked down quickly. The group on duty, C group, did an outstanding job getting that fire knocked down quickly and put to bed. We had another small fire on Dickinson Street yesterday, a porch fire that was also knocked down quickly, and no injuries reported there. I'd like to thank the mayor for his leadership in this difficult situation. We were able to get the needed PPE for the fire department as well as the police department and the rest of the city, so we are in good shape for protective equipment at this time. And I'd also like to thank the hospital, Mercy and Bay State, for the testing they're doing. They're making sure we can turn tests around quickly and get our members back to work. This week I'd like to also thank the firefighters of the city of Springfield. They're doing an outstanding job. No one's coming in if they're sick. They're keeping an eye on each other and keeping themselves safe, as well as the citizens of Springfield. This week I want to start a new program. The firehouses have always been the beacons in the neighborhoods and in the community, so we want to start to give back a little bit to the community this week. So we're going to start a food drive to help those in need in the different communities in the city who are not as fortunate. So if you would like to donate non-perishable food items, you could bring them to the fire stations. The fire stations are locked. If you ring the bell and leave the items, we will make sure they get to the appropriate location to help out those in need. We're going to try to collect this week and next week so we can deliver the stuff to the food banks on Thursday evening so they can be distributed on Friday during the day. I was in contact with the union leadership this morning, and they're all on board for this, so I'd like to thank the leadership of Local 648 for helping out in this important initiative to help those in need in the city of Springfield. That's all I have for today, and I'll see you next week. Thank you very much.
Thank you, Mr. Calvo. Bless you, Dr. Roos. He did that properly, by the way, too. Thank you, Commissioner Calvi, and to your rank and file, continuing to help those in need. And I know we have a very, very generous community to help out the food banks. Moving forward, and I call him the Wizard of Oz, Pat Sullivan. But first of all, his facilities management and parks team have done a tremendous job, especially facilities and cleaning any and all of our buildings. And he's done a wonderful job teaming up with Helen Carlton Harris and Tim Sheehan on our homeless triage medical facility that we put together in really less than a week, 10 days to a week. And so Pat's going to give you an update, and also at that point in time we'll bring up Bob Kirshner, who is a specialist in doing what we've done state-of-the-art to make sure our most vulnerable population of the homeless individuals here in the city of Springfield will and continue to get the health care that they deserve and need. The Director of Parks and Facilities Management, Patrick Sullivan.
Thank you, Mayor. First, I want to echo the mayor's comments. I'd like to thank our frontline custodial, park, and forestry employees. They've been reporting work on a daily basis and ensuring that, one, our buildings that service police and fire and Tapley Street and City Hall are being kept clean and safe, but also our park employees ensuring that the parks are available for passive recreation. I also want to send a message. I fielded some emails over the weekend. A couple of groups thought they could start in May. They've heard the news that we're reaching this plateau, but we've heard from both our doctors, our experts in the field, and our Health and Human Service Commissioner, Helen Colton. We still have a ways to go, so we need everyone to maintain their patience, and we will be reaching out to you at the appropriate time when parks would be open again. But life as we know it right now will stay with the safe social distance guidelines, and I would say that that will probably be until we have a couple of weeks of no positive tests, but we will take that direction from our medical experts. Helen and I were very proud to accept the mayor's directive to build these triage tents. And I just want to take the time one more week to thank the different companies that assisted us in this large task. Eversource, the Springfield trade staff, Springfield Finance Department, Charlie Amet Trucking, Mike Carabetta, the Barnyard and Great Country Garages, Springfield Water and Sewer, Springfield DPW, Springfield Code Enforcement, Springfield Health Department, Springfield Housing Office, the Springfield Police Department, Springfield Fire Department, Michael's Tent, the National Guard, Hamden Zimmerman, Kelly Fredette, Page Plumbing, Universal Electric, Kelco Products, Mandy's Appliance, O'Reilly Talbot and Oaken, Sherwin-Williams Paint, and the Henry County Sheriff's Department. And as you can see, these numerous companies, city departments came together to build this in just a little over 10 days. And it was very important that everyone cooperated so we could reach that goal. When Helen and I first met after the mayor asked us to find the solution in properly treating and helping the Friends of the Homeless, our goal was not only to ensure the safety of the clients and the patients of the Friends of the Homeless, but also to properly serve the first responders and nurses that would be working at this tent triage site. And you can only really do that, I think, if you have the full team is complete. And our team was made complete with Bob Kirchner from O'Reilly Talbot and Oaken. Bob is both a senior health and safety engineer and a certified safety professional, and he is the head of OTO's Industrial Hygiene Group. He has years of experience in safety compliance, asbestos management, indoor air quality emergency response training. And Bob, we just want to thank you on behalf of the citizens of Springfield and the mayor and Helen and I for working, and you're continuing to work. Bob was down there Saturday with myself as we met with the custodial company to make sure that they were going to be properly cleaning it, and he's going to be meeting with them at a location today at 501 Worthington Street to assist. So Bob, thank you so much for all that you do for our city.
Come on up, Bob. Mr. Kirchner is going to give you a brief explanation of what we've done, why we've done it, and the reasoning why. So, thank you.
Thank you, Mayor. Thank you, Commissioner. It is very important to recognize this was very much a team effort. With regards to the triage facility that we opened up across from the Friends of the Homeless, it's not a tent. In structure, it may look like a tent. It is really what we would classify as a temporary medical facility. And there's a lot of engineering, a lot of controls that went in place, and a lot of administrative controls which the staff of the Friends of the Homeless and medical personnel follow. It is important, number one, why we selected that location. And this is a really something that was developed from the ground up. We selected that location due to the real proximity of the Friends of the Homeless. That's where they're used to going. That's where they stay. That's where they eat. That's where the medical staff and their staff is. So it was important to have that close proximity to that. And when we looked at the type of facility that we could potentially use as this triage area, it was recommended, quite frankly, that we come up with a temporary shelter, i.e. a tent, to use. But I want to reiterate, it's not just a tent. This is a facility that was really constructed from ground up. It has a full wood floor surface that's been coated. It's washable. It's able to be disinfected. It's level, which most parking lots, are angled for drainage. So this was an important part. The tent itself is in fact a tent, but it has full permanent electrical service. It has full restroom, hot water, water facilities, showers, and restrooms that are plumbed in place. It's not the porta potties that you typically would think of. Our goal in designing this system was to be able to isolate and prevent cross-contamination. So it's not a tent, it's a series of tents, 3 tents that we use. We have a smaller tent, which is basically a processing tent. It's a tent where individuals can come in and be tested. And then once they're tested and we're awaiting results, the individuals will go to one of the larger tents that you see on site. That is where they will stay until we determine, their status, in fact, whether they're presumed or positive. If they are, in fact, COVID positive, they move to another tent, which is immediately adjacent. It's important to understand all 3 tents are separate. So they all have very specific controls of how you would enter each tent, how you would exit each tent. We've designed very specific entry and exit levels where we don personal protective equipment in a very linear fashion, and also at the same time are able, at the end of the work shift, be able to doff and take off your material in a safe area to prevent cross-contamination. That is vitally important. The building materials and controls that were put in are all able to be washed and disinfected, and we've reviewed this. One of the key things that we get into with the design of these tents is the HVAC system, the heating, ventilation, and air conditioning systems for each of these tents. They are heated via electric. It's a forced air system. They also have air conditioning. Hopefully we won't need this too far into the heat season, but if need be, we can run it with air conditioning through the summer warm months. The key issue with this is also ventilation. We supply fresh air ventilation to all 3 tents. Those HVAC systems are isolated, so they're each separate for each tent. They don't cross over from the contaminated tent to a pending tent or to the testing tent. They're very isolated and separate. The HVAC units that we've selected for this have a high efficiency filtration, particulate filtration that we use. In addition to that, due to the activities being performed in there, we've put in and installed UV germicidal lamps, ultraviolet germicidal lamps, inside the supply air ductwork for each one of the systems. There's a total of 7 systems that we're using on the 3 tents. And that is vital. That helps us prevent the potential of cross-contamination. It also helps us in the event that materials become airborne, that the UV germicidal lamps will help in neutralizing the virus. I did mention that we worked extensively with the medical staff and medical personnel who will be working in this. The way we've designed it is we've set up a see-through walls for all intents and purposes. They're impervious walls made out of plexiglass for nurses' station or medical stations that when they're standing or sitting in their nurse station doing paperwork or non-patient contact care, they can see 360 the entire tent that they're assigned to, and that's important. They wanted to be able to, in a moment's notice, look from one end of the medical facility to the other and be able to see where patients are or if other staff is in need of assistance. I did mention that there are linear decontamination and entry points. They go through a very stringent process going in and a very stringent process on the way out where things are disposed of and laundry is taken care of. So, in summary, it's not a tent. I call it a temporary medical facility. It's equipped with pretty much anything you can think of for the type of medical activities that are being performed within there, in that space. It's the nursing staff, medical staff that's there. They're well protected, both in terms of personal protective equipment, gowns, and other material that they need going in, as well as going out. One other added benefit that we put, if you can envision, we're on Worthington Street and Taylor Street. Taylor Street is the lower side. We do have trailers there, camper trailers, specifically for medical staff and medical personnel who work on site, so that if they are having a break or if they need lunch or their meals, they can then leave their tent control area, med station, and they can walk to a secure area where they do not require personal protective equipment, can wash, clean, and eat, take a relaxing break in a clean environment. So I want to thank all of the facilities people, Armit Trucking especially. They've really coordinated this with contractors and subcontractors, and especially with all of the facility, Springfield facility personnel. It really was a team effort, and it worked out extremely well. Thank you.
Bob, could you just clarify about the standalone facility that we have, and the reason on the air with some facilities, if it's a physical plant facility, why they're having some issues and trouble with the proper airing?
Right.
Venting is not good?
That was a question that came up early on, is that why can't we use one of our abandoned buildings or an abandoned school or an abandoned hotel? Quite frankly, those buildings present, from an industrial hygiene perspective, more risk for cross-contamination. They're not a medical facility in design, such as the Trinity Healthcare and or the Bay State medical facilities. The problem that you get into with these, and this is what unfortunately we're going to see with a lot of the long-term health care facilities, i.e. the nursing homes, is that once that virus is in that area, I'm unable to isolate and control it. As a result, the HVAC systems will then take that and move it from one area to another. I don't have methods of isolating patients in one area when I'm still using the same air handling systems and controls as either COVID positive versus non-COVID patients. I experience the high risk of cross-contamination, which is what we're trying to avoid through this temporary location. The other issue is we were able, in this particular situation, to design what building materials, i.e. floor surfaces, HVACs, electrical, how things are connected, showers, restrooms. We were able to design that from the ground up. If we were to move in, for example, or use an abandoned school or an abandoned building and try to reconvert it, I have to worry about building surfaces. I have to worry about porous surfaces in particular, carpets, things that are difficult, if not impossible, to clean for the level that we need for this particular facility. That's why, in the early portions of this, when we were going through the initial design, we recommended a standalone temporary medical facility using a tent-type structure and then building the rest of the infrastructure around it. It makes the staff much safer, as well as the patients who occupy that facility.
Thank you, Bob. Thank you very much for clarifying.
Thank you, Mayor.
Thank you. Thank you, Mr. Kushner. That should clarify some of the questions that were emanating out in the community, though we received many, many compliments for how quickly we acted to make sure our vulnerable population of homeless individuals are going to be taken care of and properly. As soon as it was brought to my attention by our hospital facilities, Friends of the Homeless, the city moved very quickly 2 weeks ago to make sure that we're doing above and beyond for our homeless population. And I think Mr. Kirshner's clarification can lend information on why certain sites were not picked, why they should not be picked. And also with our schools, we're running 17, 18 sites that are food sites and other areas. So we have a first-class, state-of-the-art medical triage unit at Worthington Street to make sure our vulnerable and homeless population are receiving the help that they need. With that, let me turn it over on our school side to Superintendent Dan Warwick. He and his staff, teachers, rank and file, administration, school committee have done a tremendous job in our meals program. Again, well over 200,000 meals have been served. And in total, besides the 7,000 computer laptops we already had out during our school year, 10,000 laptops, whether being delivered through Vanpool or being picked up at certain sites, are continuing the virtual learning that our teachers are doing for our students. Without further ado, Superintendent Dan Warwick.
Thank you, Mayor. Good morning, everyone. As the Mayor said, we've been working hard on the lunch and meal distribution program. On Thursday, because we had the long weekend, we distributed 60,000 meals to families in Springfield. That brings us up to about 200,000 meals. This week, we're doing 3 meals a day plus a snack for everybody. So that distribution is going to keep going. On next Monday, Patriots Day, we're going to be open for the meal distribution because we don't want to try to get so many people together for the long weekend again. So we'll be open again and distributing meals on Patriots Day. I just want to thank the mayor and the school committee. With their support about 5 years ago, we made some real sacrifices in our budget to invest in technology, the infrastructure, and the laptops. Due to that, we've been able to distribute 17,000 laptops to our students to work with at home. And for families who didn't sign up for the first distribution of laptops, please contact your school if you need a laptop, and they'll be available to you again for you to pick up, or we'll deliver with Vanpool again as we did last time. So thank you to Vanpool. Going back to the food distribution, I just want to take the time to recognize our partner, Sodexo. That's been an incredible partner through several issues here in Springfield, but they've really stepped up and their staff has been working hard. We are implementing a remote learning plan due to the investment we made in technology, and I'd like to thank my staff and my teachers for working hard to reach out to students and their families and continue learning in the best way possible during this new normal we're now experiencing. On the statewide front, the commissioner recommended to the legislature, and they approved it, and the governor signed it this weekend, that MCAS is being canceled for this year. That was a good decision. We wouldn't have had the instruction necessary to deal with the MCAS. They also are dealing with a competency determination. As you know, to graduate from high school, students need to pass the MCAS, and they have some chances at retakes. For students who didn't have that opportunity, the competency determination is going to be waived this year for graduation. Just like to thank the mayor for all of his support during these difficult times. Thank you.
Thank you, Superintendent Warwick. Thank you, Superintendent Warwick, Dan. And again, we'll await to see what direction the school system will or will not go. Obviously, we'd love to get back, but again, we would only do that in the appropriate time frame with the guidance of medical, health, and science experts. But learning continues to go on. With that, let me bring up on the DPW front. They are out there. Men and women, they're out there continuing to pick up the trash, yard waste, continuing street services, and for that, sometimes that's forgotten. We deeply appreciate it. So without further ado, under the great leadership, DPW Director Chris Signoli.
Mayor, thank you, and thank you everybody here. Number one, as the mayor mentioned before, we have 2 employees out. They have not tested positive. They have family members who are either positive or presumed positive. So we are at as full of a group as we can be at this time of the year. We started our yard waste last week. It was the first week. This is the first week as we make our 2-week rounds around the city. So I would anticipate that by the end of the week, we would probably be a day or so behind. So have patience and leave your material out, and we will pick it up. Construction has started in the city. It is starting very, very slowly, but it will start to ramp up. Many of the companies that are out there, the private companies that work for us, are slowly bringing employees back. Not wanting to bring them back all at once, fearing that they may have to lay them off. So it's going very slowly, but there is activity out there. For residents out there, any issues that you see related to DPW or anything else, get in touch with 311. Potholes, drainage issues, especially a day like today, road issues, street signs, traffic signals, let us know. We have our employees working. And I really have to thank our employees. They have been working 100% full-time throughout this entire event. I cannot thank them enough for their dedication in doing everything that we need to do. And with that, I wanted to have a shout out to Nathan Bills, who last week provided over 100 lunches to all of my employees as well as everybody else at Tapley Street, including all of the facilities people working at the facility up there. So thank you for taking care of them on a Friday. Good Friday, it was fish and chips, so everybody behaved. But I really need to thank everybody, and especially my employees, and especially the team here with the mayor. So thank you very much, and if you do see any issues related to DPW or anything else, please get in touch with 311. Thank you.
Thanks. Thank you, Director Signoli, and to your whole team. And I want to give a shout out also to 311 because they're there faithfully every day, and 911 our dispatchers that are there. City business continues to go on, and again, much of our workforce, a lot are working. Some are working remotely. Others are in areas 1 or 2 enclosed buildings to make sure backup work can be done, and security being there. So now we'll move, again, Springfield's in the business of being in business, and the Chief Development Officer, Tim Sheehan, and the rest of his team, Brian Connors, have done yeoman work to make sure that we're able to put out $750,000 now of $1 million of grants to our restaurants and small businesses. Again, this is unlike the state or federal level where the majority of those, if not all, are low-interest loans that you have to follow certain requirements maybe to get them forgiven. These are grants. And again, we want to be able to try to help out each and every one of you, but we do have to follow HUD and CDBG rules and regulations. Those applications are out there. Tim will expand upon that more when they're due, but that will make $750,000 out there. The earlier $225,000, $222,000, I think checks could go out as early as this week. We're signing contracts Friday night. Without further ado, the Chief Development Officer, Tim Sheehan.
Thank you, Mayor. Just to give an update on the restaurant fund, roughly a third of the restaurants have been cleared to contract. As the mayor indicated, those checks should be going out soon, as early as this week. The remaining restaurants, we are working directly with them to get them cleared into contract as expeditiously as possible. It would be very helpful for businesses that are anticipating to apply to the small business development round and those that are still awaiting contract to put together your business information, your permitting information, and your payroll information as soon as possible so that we can clear you for contract as quickly as possible. As the mayor indicated, the small business grant program went live on Friday morning. Applications are due back Thursday by close of business. Again, if you intend to apply, please put together your information ahead of time so that when the awards are made, we can process as expeditiously as possible. Again, if you are a business in Springfield of less than 500 employees, I strongly encourage you to go to the SBA website and register your business so that you can be eligible for the business assistance that the SBA provides. The whole purpose of both the Restaurant Fund and the Small Business Development Fund was to assist businesses in this time period between the availability of the federal government's resources to assist you. It is going to take time to get those resources out to you, and our program was basically designed to provide you with some resources to get you through that difficult period. Thank you, Mayor.
Thank you. Thank you, Director Sheehan. I believe in our early morning updates that Solicitor Pakula and HR and Labor Director Bill Mahoney said we're status quo on that, and I explained to you our ongoing financial situation with CAFO, TJ plant where we are, and again, we're tracking everything to make sure we can go after any and all, every dime that's deserved for our Springfield residents and business community. With that, I'm going to open it up to questions. I would like the first questions, obviously, of my cabinet heads and myself, if you need us, but to Dr. Kerouac and Dr. Roos, who I deeply, deeply appreciate. Every Monday, we will continue these every Monday at 10:15. They take the time out of their busy and hectic schedules from Bay State and Mercy to be here. So I'll open it up at this time for questions, and if your first questions can be directed to Dr. Kerouac or Dr. Roos. Thank you. Audrey?
Yeah, no, I was the question both for the Bay State
Okay.
health representatives.
Dr. Kerouac, did you, Dr. Roos? Mike, please.
I wanted to ask about the long-term care facilities. Obviously, optimism from what you guys have seen on the hospital front. I did hear you guys mention that you were assisting long-term care facilities, like Willow Children's Home. I was wondering if you guys had extended similar help to JGS, like care culture you saw at the times, like in deaths from COVID-19. What specifically are we doing in these homes to help mitigate the spread, which seems to be very rampant in these types of facilities?
So we've been convening groups of 15 or 20 of the medical directors from these nursing homes, directed by what we know from the cases that we found there, to make sure that they have everything they need, that they can do testing, that they have PPE, and most particularly that they have the expertise and know how to actually do infection control. Because what you want to do is to separate out the people that you know are uninfected from the people that are clearly infected, in other words, positive, and then the folks about who you're uncertain about. So you really need to create 3 different cohorts of people to keep the disease from spreading. And in many of the instances, what we find is that what they're most interested in is infection control expertise. We've actually been able to share with them what we know, give them videos about how to put on and take off the equipment. In one instance, have even identified a volunteer to go and do the infection control training and the work there.
Are you able to say the number of long-term care facilities that you guys have some sort of presence or have extended some help to?
I'm not sure of the exact number. I know we have ongoing medical director relationships with about 20, but I'm not sure how many of those have asked for our help.
I would just echo, Trinity Health does have several long-term care facilities of our own in this area as well, and we have been partnering with them in addition to providing some guidance to some others. And in addition, we also sent an infection prevention nurse out to the correctional facilities Friday and Saturday, I believe, to also assist with the appropriate training for donning and doffing of PPE to provide that expertise that we're comfortable with on the hospital side to some of the other facilities in the area.
Any other questions of Dr. Kerouac and Dr. Roos? Say again, any other questions? Gentlemen, thank you so much for taking the time. I'll talk to you probably during the week, and we'll see you Monday morning again.
Thank you.
Good health, and thank you for everything you and your teams are doing. Also, with those long-term care facilities, nursing homes, Commissioner Helen Carlton-Harris and DPH Secretary Mary Lou Sutter, Department of Public Health, are working very closely with those long-term care facilities. So with that, I don't know if you have any other questions. Yes, Audrey?
I do. For Mr. Kirchner, actually.
Sure.
You mentioned the situation in the HVAC
Yes.
system. Was that an issue that you guys had identified specifically in any local long-term care facilities with the spread through the system?
I'll let Mr. Kirchner speak. Again, the best case practice is how we could deal with our homeless population. So that's why we went to a specialist. Mr. Kirchner?
I'm sorry, Mayor. Can you say that one more time, please?
I heard you mention concerns with HVAC systems possibly spreading it. You mentioned that was something that you've seen in long-term care facilities. I was wondering if you've seen that in local long-term care facilities that maybe have
In general, just as a statement, and I've been in healthcare for over 25 years, but in general, long-term care facilities aren't designed the same way a hospital would be, where you can isolate areas, where you have separate HVAC zones or systems for that particular area. You can control and isolate, as the two physicians just mentioned, using positive and negative pressure controls to keep air from passively infiltrating another area. Unfortunately, the long-term healthcare facilities, mentioned Holyoke Soldiers Home and Jewish Nursing Home and others, were never designed for that. They were never designed for in anticipation of a pandemic type situation. So, as I mentioned previously, when we designed the triage center for the homeless, we knew we couldn't do that with a building. And that's why we decided to go with 3 separate isolated tents with their own isolated HVAC systems. Does that make sense?
Thank you, Mr. Kirschner. And again, as you can see right now, by doing these prudent measures, 6 homeless individuals that we're dealing with. And unfortunately, that was our concern when we started to put this together 2 weeks ago, that if someone, he or she, was to get back in the facility on the street, it could spread like wildfire. So that's why we put together this state-of-the-art tenting triage medical facility adjacent or across the street from the Friends of the Homeless on it. So I'm so happy that Mr. Kirschner, we asked him to come by to explain the sophistication of what Pat Sullivan, Helen Carlton Harris, Tim Sheehan have, my administration have put forth in working with all of our partners. Any other questions or comments? Yes, Audrey, the floor is yours.
I have one more for Mr. Warwick.
Certainly, Superintendent Warwick.
Thank you so much. I was just wondering, you mentioned the MCAS testing being waived. For students who received sophomore students who are working towards the John and Abigail Adams scholarship, which I know is used and determined on the basis of the sophomore MCAS testing results. Have you guys gotten any guidance from the state on how you would award that money, given that the tests are being waived in a lot of places?
Yeah, for the kids who are graduating this year, they would still receive that John and Abigail Adams because of their 10th grade results. And in the future, this class, that going from 10th to 11th grade, will still have that opportunity. So they won't lose that opportunity for John and Abigail Adams.
Will they use the 11th grade results?
Yeah,
Okay.
sure.
Any other questions or comments? We're in the midst of time that, and Springfield is known for a place of innovation and invention. Life as we know it will change, but change for the better, but we're going to do business differently now. There's going to be a lot of different things, whether done in the health field, medical field, the science field, from dealing with something, street activity, all the way up to being together again at ball games and restaurants. It will occur, but there'll be a evolution that's going to occur as we move forward. The last thing I want to say too is, and again, the public and the private sector, business sector has been so great. Please, if you can, I desperately need, especially for our frontline providers, our brave and dedicated police officers and firefighters, thermo-infrared thermometers, ASAP. I could use about a dozen or so because we're going to go into, so we could take temperatures. It would be very important. Again, thermo-infrared thermometers, a dozen or so I could use. We've gone to the private market trying to get them. MEMA sent oral thermometers. Again, we need the thermal, and I appreciate what they've sent me, especially for their homeless triage tent. But I'll say it again, thermo-infrared thermometers. If you can get me a dozen or so ASAP, my police and fire department and frontline providers will deeply appreciate that. I want to give a big, big thank you to our sign interpreters that are here. We finally were able to get you. Thank you very, very much. We're trying every and all angles to get information out, so thank you, and good health to each and every one. To the media, you have been great, great partners. Great partners to make sure that we continue to get all this information out. All this information is on our websites. Of course, you can call 311. We also have the new hotline that we have on there. Again, we did, my election commissioner Gladys Oyola represented me very well late last week with a Latina podcast to get that message out on our websites. We're able to translate. You go right there, there's a little gadget you can hit, almost 90 different languages that will translate all that information. But I can't say to you enough what Commissioner Helen Colton Harris and other medical officials, Dr. Kerouac, Dr. Roos say. Though it seems simple and though it seems common sense, social distancing. And that goes a lot to your young people that are out there. And I hope these social media influencers, or I'm seeing more and more PSAs now, personal service announcements, letting them know, take this serious. You're not invincible because you could spread it to a family member. Wash your hands constantly. Now start to wear, as we're doing here, wear the mask, especially if you have to go out to shop. Larger box store or even smaller stores, wear that. And if you don't feel good, please stay home. Use telemedicine, call your medical provider if you have to. Again, testing is available at the hospitals. But I promise you, especially here in the city of Springfield, where we've been tested and true through a number of natural man-made disasters, we will get through this together as one and for the better. We're starting to see a little sunlight now. But we still got to keep those sunglasses on and do all the proper things. There's going to be a phasing in that's going to occur as we move to a new normal. So we have to adhere, as Helen Colton Harris indicated to you, we've doubled in a week. To 541 right now. And to our knowledge, as of today, 11 individuals have lost their lives. And to the family members, my heart goes out to you. But we've also heard great stories of generosity, great stories of people recovering from Bay State and Mercy Hospital. So we'll be with you next Monday at 10:15. If anything else should occur where it arises as something good or a challenge we have to face, we will call a press conference. In the meantime, everything daily we are updating on our websites. And again, to the media, thank you very, very much for getting this information out. God bless you, God bless your families, and God bless our city of Springfield. Thank you so much.